Good day everyone, I am Dana Encarnacion from Group 2 and today we're going to tackle about the epilepsy and other brain seizure. So let's move on. In this report, we're going to talk about the disease which is the epilepsy, causes of epilepsy, clinical features, diagnosis, treatment, and last but not the least is the epidemiology and pathophysiology. Epilepsy is a group of neurological disorder. An epileptic seizure is a paroxysm or sudden of uncontrolled discharges of neurons causing an event that is discernible or visible by the person experiencing the seizure or by the observer. The tendency to have recurrent attack is known as epilepsy. Anything that interrupts the normal connection between nerve cells in the brain can cause a seizure. This includes a high fever, low blood sugar, alcohol or drug withdrawal, or a brain concussion. Under these circumstances, anyone can have one or more seizures. However, when a person has two or more recurrent unprovoked seizures, he or she is considered to have epilepsy, including an imbalance of nerve signaling chemicals called neurotransmitters. Tumors, strokes, and brain damage from illness or injury are some combination of these. In majority of cases, there may be no detectable cause of epilepsy. There are three causes of epilepsy. One is symptomatic epilepsy, two is idiopathic epilepsy, three is cryptogenetic epilepsy. So, symptomatic epilepsy can be defined as epilepsy that follows an injury to the brain known to be capable of causing epilepsy. Example include significant head injury, CNS infection, stroke, brain tumor, and a brain surgery. Idiopathic epilepsy is known as where no apparent cause of epilepsy can be found, but there may be a family history suggesting that condition is inherited. Cryptogenetic epilepsy, this is when cause for a person epilepsy that has not been found or in despite of investigation. There are different signs and symptoms of epilepsy. Symptoms vary depending on the type of seizure. In most cases, a person with epilepsy will tend to have the same type of seizures each time. So, the symptoms will be similar from episode to episode. If there's a chance that you encountered or feel this type of signs and symptoms, this might be the reason or this is the sign that you are experiencing or having an epilepsy. So, number one is the loss of consciousness and awareness. In this episode, you will experiencing of blacking out or falling down. So the second one is the stare or the staring spell. The third one is the psychic symptoms where you feel or felt the fear, anxiety, deja vu. So the last one is the stiffening of muscles where your arms and legs are uncontrollably jerking, moving.
Clinical features. According to how the abnormal brain activity first manifests, doctor typically divides seizures into two categories, focal and generalized. Focal seizures. These seizures are referred to be focal seizures when they appear to be caused by abnormal activity in just one part of the brain. Two categories of focal seizures. 1. Focal seizures without loss of consciousness. They might modify emotion or alter how things taste, smell, feel, or look. 2. Focal seizures with impaired awareness. You might stare up into space, not react to your surroundings as you normally would, or make repetitive movements like rubbing your hands together and chewing, swallowing, or pacing in circles. Focal seizures with the motor type. First is atonic. The person's muscles suddenly relax and they become floppy, that they can collapse actually. Another one is the exact opposite of atonic, the tonic. It causes the muscles in the arms, legs, or trunk to become suddenly stiff or tense. Next is clonic, the repeating jerking of the muscles. Another one is myoclonic. Seizures are brief, shock-like jerks of a muscle or a group of muscles. And the last is Jacksonian march. For example, clonic seizure starts with the hand, then moves up into the arm and moves up into your upper arm, and your entire arm is involved. Focal seizures within focal sensory. If you're having abnormal electrical activity, you can feel pain and paresthesia, so you can also have Jacksonian marches. You can also have visual hallucinations, hear abnormal sounds like ringing, smell abnormal like burnt toast, and abnormal taste in your mouth, maybe like metallic taste. The last part of the focal seizures are focal autonomic and psychological. Whenever there is autonomic involvement, it can increase your heart rate, leading to tachycardia, and also increase your blood pressure, leading to hypertension. It can also act on the actual bladder system that can lead to urinary incontinence, and it could also actually affect salivation and sweating. While in psychological symptoms, they can be emotions like angry and hypersexual, and deja vu for fear, dispersonalization for yourself and the environment, or derealization, which is kind of disconnect from your environment. Generalized seizures, which appears to affect all parts of the brain, are included in the second category of clinical features. There are 6 categories of generalized seizures. The first type of seizure is called an absence seizures, which frequently affect kids and is distinguished by blank stares or subtle movement of the body like sleep smackings or blinking. Second is tonic seizures, cause of stiffening your muscles. Your back, arms, and legs are typically affected by these seizures, which might make you lose your balance and fall into the ground. The third type, known as atonic seizures, results in a lack of muscle control and may lead to your collapse. Fourth are clonic seizures, which includes repeated muscle jerks. The arms, face, and neck are typically affected by these seizures. Fifth, tonic-clonic seizures, which can result in loss of bladder control for tongue biting, produce a sudden loss of consciousness, stiffening of the body, and shaking. The sixth kind is myoclonic seizures, which cause your arms and legs to jerk, to twitch briefly or twitch.
Now let's talk about the diagnosis for epilepsy. If you have a seizure, a general practitioner may refer you to specialists to find out what your seizure causes. You usually see a doctor called neurologist. Neurologist, this is someone who's an expert in conditions that affect the brain and nerves. They want to find out more about your seizure and may suggest having some tests, waiting to see a specialist. You should see a specialist within 2 weeks of being referred. There's a chance you could have another seizure while waiting for your appointment. So during this time, it's best to avoid activities that could put you or others in danger if you have a seizure. For example, you should avoid driving and swimming until you see a specialist. Contact a general practitioner for advice if you have another seizure while waiting for your appointment. Finding about your seizure. It can be hard to diagnose epilepsy because other conditions, such as fainting, mind waves, and panic attack, can cause similar symptoms. It often cannot be confirmed until you have more than one seizure. Help your specialist if you can describe what you remember about your seizure in as much details as possible, including things like when you had your seizure, what you were doing when it happened, how you felt before, during, and afterwards. It may help to write some notes before someone who's seen you have a seizure, or doing a video recording of you having a seizure if possible. Tests for epilepsy. The specialist may suggest having a test to check your brain activity, called an electroencephalogram, or a brain scan to look for any problem in your brain. But if these tests do not show anything, it is still possible you have epilepsy, and you may be diagnosed just based on your symptoms. Checking your brain activity. An electroencephalogram is used to check for unusual electrical activity in the brain that can happen in people with epilepsy. During the test, a small sensors are attached to your scalp to pick up the electrical signals produced when the brain cells send messages to each other. The signals are recorded by a machine and looked at to see if they are unusual. A brain scan can help spot problems in your brain that can sometimes cause epilepsy, such as an unusual growth, damage to the brain, such as damage caused by a stroke, or a scarring in the brain. The brain scan uses a magnetic resonance imaging scan. The scanner is a large tube that you lie inside.
Treatment is usually considered after diagnosis of epilepsy medication. The aim of treatment is to stop all of your seizure with the lowest dose of the fewest number of ASMS and with the least side effect. Ketogenic diet is one treatment option for children or adults with epilepsy whose seizures are not controlled with AED. The diet may help to reduce the number of severity of seizure, may have other positive effects. The ketogenic diet typically reduces total carbohydrates intake to less than 50 grams a day, or less than the amount found in a medium plain bagel, and can be as low as 20 grams a day. Generally, popular ketogenic resources suggest an average of 70 to 80 fats, and total daily calories is 5 to 10 carbohydrates and 10 to 20 protein. What do you eat for a ketogenic diet? Fish and seafood, low carbs veggies, cheese, avocado, and egg and seeds, and also yogurt. Vagus nerve stimulation therapy is a treatment for epilepsy that involves stimulator or false generate which is connected to inside the body to the left vagus nerves in the neck. What is vagus nerve therapy for epilepsy? Vagus nerve stimulate VNS therapy is a treatment for epilepsy. The vagus nerves run up to the side of the neck and into the brain. The VNS sends electrical pulses to the nerves, which carries the pulse to the brain. This helps prevent a shorter than length of seizure. What is the role of vagus nerve stimulation in the epilepsy? Vagus nerve stimulation can be done in many ways with many devices. An implantable vagus nerve stimulator has been approved to the Food and Drugs Administration of PDA to treat epilepsy and depression. The device works by sending stimulation to area of the brain that leads to seizure. Epilepsy surgery brain. This is one way to treating epilepsy. Certain criteria have to be met and tests have to be done to assess stability. Can epilepsy be cured with surgery? Temporal lobe resection often results a cure with significant improvement in the number of severity of seizure. Research shows 60 to 70% of patients are free of seizure following the surgery, which is typically well tolerated and required to brief hospital stay. What kind of surgery is done for epilepsy? The most common surgical procedure for epilepsy is the removal of small portion of the temporal lobe during procedure called temporal lobe resection. What is the purpose of epilepsy surgery? The goal of epilepsy surgery is to either to define and dissect an area of this and or disrupt, spread the seizure activity to reduce the likelihood of seizure, prevent certain seizure type, remove an area of the brain which a seizure occurs. Epilepsy surgery is most effectively when seizure always occur in a single location in the brain. Epilepsy surgery is not the first line of treatment, but it might be an option when at least 2 or anti-seizure medication have failed to control seizure.
Epidemiology. The incidence of status epilepticus has a binomial age of distributions with the peaks during infancy and in the elderly. The incidence rate range between approximately 7 to 40 cases per 100,000 persons in years. Status epilepticus seem to be more common in males, a significant proportions of both children, 60 to 38%, and adults, 42 to 50%, with status epilepticus have a history of epilepsy. Pathophysiology. A seizure of a very 6-mile electric discharge of a neuron in the brain resulting in a change of functions or behavior. It is important to understand that a seizure is a CNS event and may present as convulsive or non-convulsive.
If you see someone having an epileptic seizure, stay calm. Nearly all seizures look worse than they are. The most important things are to prevent the person from being injured and to stay with them. Put something soft under their head and move dangerous objects out of the way. Please don't hold the person still. If necessary, loosen any tight clothing. Look at the time and note how long the seizure lasts. That's important for later, but please don't put anything in the person's mouth. That can do more harm than good. You only need to phone an ambulance, 144 in Switzerland, if the person is injured or the seizure lasts over 3 minutes. Afterwards, check the person is breathing and put them in the recovery position. Then inform their emergency contact. If it's the person's first seizure, they